Welcome back. All right, we've got Peel's Medical Officer of Health joining us, Dr. Lawrence Loh, and we have so many questions and calls, and we want to get right to it. So we say, good morning, Dr. Loh. How are you?
Morning, Sid and Mel. It's good to see you.
Good to see you, and thank you for doing this with us. Let's get right to it. We have a tweet here from Blair asking this. I would like to know the doctor's opinion on the announcement yesterday from the CDC in the States regarding mask wearing for those who are vaccinated. Is this good science? Is it premature? What are your thoughts, Dr. Loh?
Well, I think the U.S. is in a very different place than we are in Canada. They have vaccinated steadily, and they're now at, I believe, over 50 or 60% single dose covered, and almost over 40%, second dose covered. Whereas we've taken our first doses fast strategy to try to get first doses out quickly, but we're still only 3.5-ish, 4% vaccinated across the country. And so what this means is they're starting to see changes in transmission patterns that might allow them to loosen on some of the restrictions, whereas we're probably a little ways away yet. Now, that said, even when you do get to that point of transmission, one of the challenges is if you start removing masks broadly, you don't necessarily know who's had their 2 doses of vaccine versus who is still hasn't had their vaccine yet. So it may even be a bit premature for them, but I think it's something we'll continue to monitor, and our provincial counterparts will come out with guidelines if and when we get to that point.
All right, Dr. Loh, let's go to the phone lines. Ruth from your neck of the woods, Mississauga, joining us on the line. Ruth, good morning. What's your question for Dr. Loh?
Good morning. Thank you first, Dr. Loh, for all your support here in Mississauga. I really appreciate it. So my question is, because of the efficacy, or not the efficacy rate, but more the fact that we've extended our shots by 16 weeks, which I completely understand, are we going to have the same sort of safety once we get our second shots, similar to the U.S., because the U.S. obviously followed the 21 days? Are we going to still fall into that still safety and almost be, somewhat immune, or is, the virus is obviously a lot less dangerous at that point? Will we have the same effect once we get those second shots as they do when it was in the 21-day cycle?
It's a great question, Ruth. I mean, the National Advisory Committee on Immunization has been pretty clear that there's pretty good real-world evidence that even beyond the 21 days, giving the second shot is still quite effective. I also just read a new study that came out of the UK that shows that it actually may even be more effective than the original manufacturer's interval. The biggest thing with the 2 shots is to make sure they're not given too close together, because the first shot gives your immune system its initial boost, and the second shot helps to basically boost it again. So there's no point in giving a second shot too close to the first shot because otherwise the second shot is ineffective. But, figuring out that perfect interval between shots, that data is still coming in. So hopefully we'll see some benefits out of the strategy we've taken here in Canada.
Great question there,
Mel,
Ruth.
permission to ask the doctor a question for me, because doctor, I got Moderna Saturday to pop up in Peel, and it knocked me on my butt for a few days. I'm elated that I got it, but what should I expect when I get the second dose?
It's a great question, Sid. To be honest, I'm trying to figure out the same thing as well, because I myself got Moderna as well. Honestly, I agree. It felt like someone had punched me in the arm hard and all these other pieces. Depending on the individual's immune system, some people have had no symptoms. For example, my wife is a frontline physician, and she got her second shot. Nothing happened. She's actually worried that she might not be protected. But then you've got actually some other folks who have some, a boost means a boost on the symptoms as well. So you're not going to know until you get it. But it is an important message to say, second doses also still tend to be mild side effects. And you really need to remember it's not a one and done deal. Get that second dose when they're available.
Yeah, good question, Sid. I believe we have someone back on the lines for us. Melissa, good morning to you, Melissa. How are you?
I'm good, thank you. How are you?
Wonderful. And your question for Dr. Loh this morning?
My question is, if you have an allergy to the flu shot, what is the best COVID shot to receive?
So, Melissa, right now there isn't any contraindication to receiving a COVID shot if you've got an allergy to any other vaccine specifically. In general, if you do have a history of anaphylaxis, they do say that you should double check with your primary care provider, and anaphylaxis meaning like really severe allergic reactions. But otherwise, there are very few contraindications, and certainly none related to having a contraindication to the flu shot previously.
Okay, thank you, Melissa.
All right, let's go to the tweet from Francesco, guys, before we let Dr. Loh off the hook here in this segment. And Francesco writes, Doctor, what advice do you give individuals like myself who received AstraZeneca and are left feeling, despite themselves, like guinea pigs and ticking time bombs? I made the decision with my physician, yet looking at the second dose and possible side effects, I mean, Doctor, I'm assuming you're getting this question a lot. What is the company line here on people who got AstraZeneca first dose?
Well, I mean, it's not really a company line. It is a reassuring line to just tell people you did the right thing. Honestly, by the way, if you're past 2 to 3 weeks after your shot, the risk of that very rare side effect has essentially dissipated. And I think the biggest thing to share is when you got the shot, at the time you got the shot, we were in the midst of a really severe third wave. And the worst thing to do would have been to actually be unprotected. So you accessed very good protection during a very uncertain time. And I know that the provincial government's going to be taking care of you and figure out how to either get you a second AZ or mixing things up and ensure that you get that full protection even in the end. So thank you for having taken AZ.
Yeah, a lot of people asking those questions. Dr. Lowe, we appreciate you taking the calls and the comments and all of the inquiries. You're going to stick around. So you're going to stick around for another 10 minutes, and we're going to rejoin you and talk a little bit about what's happening in Peel Region. You've got some incredible initiatives to get people vaccinated, so we'll do that with you in 10. Thank you for that. And coming up next, Sid, sorry, there is no souvlaki on the Danforth. There's no jumping and waving. I know you're good at jumping and waving.
Yeah, there's some big events. It ain't happening.
Yeah.
Ain't happening.
Yeah, so we're getting the word here about some of the big events being canceled in Toronto. We will break all of it down for you up next.
We can double wrap.